Hey everybody, it's me, Helen Hicks, and I wanted to share with you guys why certain types of trauma response techniques work. So I know there's a lot of different options out there: EFT tapping, havening, EMDR, biofeedback, all of these lists of techniques. And I'm sure some of you may have questions in regards to, well, which one is the best one? Which one should I use? Do these things really work? The answer is yes, they do work. And which one works for you depends on you. So basically, why these things work is when something traumatic happens to you, your body has an automatic way of responding to that trauma. Your heart starts racing, your breathing gets very shallow, you start sweating profusely, your muscles tense up. All these different things start to happen in your body because your body is biologically designed to respond to certain situations in this manner. Well, what happens with PTSD is that when you have any hint of that same type of feeling, your body jumps back into this whole physiological response, even without that same stimuli being present. And it definitely becomes very problematic for people because they start feeling like they don't have any control over this and they feel victimized by their own body. So, what happens with these techniques is they teach you how to reshape your body's response to these very strong emotions. So basically, any one of these techniques that you decide to try out, what happens is you have to first pull up that emotion that is associated with the situation. This is really, really, really important because if you don't first connect with that emotion, then none of the rest of this really works. So first you have to get in contact with that emotion. And then, instead of allowing your body to take its natural course and go into panic mode, you will have somebody instruct you on how to change that response. Whether it's the tapping, it's the havening, it's the EMDR, or it's the biofeedback where they have you hooked up to wires and you're trying to change whatever physiological response that you're engaging in. Regardless of which technique it is, all of it is to get you to learn how to train your body to have a different, calming response rather than a panic response. So if you have endured any type of traumatic experience and you are suffering from PTSD symptoms, then please check out any number of these techniques that are available, whether it's on YouTube, it's in someone's private practice, whatever it may be. Some of these things you can do on your own, and others you will need the guidance of a professional to do so. But the essence of all of this is the same: to teach your body how to respond differently to that same emotional stimuli.